As Mental Health Awareness Month comes to a close, we explore a little-known therapy for deep depression that's gaining popularity. It's non-invasive and is typically used only if medications don't work. Welcome back. I'm Carlo Cicchetto.
I'm Marcella Lee. One local veteran tells me it changed his life. It wasn't an easy decision for him to share his private story, but he agreed to sit down with me and open up about it to let his fellow veterans know there is hope.
Navy veteran Bill Waite says for the first time in a long time, he is fully enjoying life.
I can say with all honesty, this is probably the best thing I've ever done for myself.
Now he wants to do something for others.
That picture was taken outside of Utapao Air Base.
By sharing his story.
At the end of the day, I've been thinking about this a long time. I just want to be an advocate for other veterans.
After a 20-year military career.
I actually enlisted at 17.
That he absolutely loved.
What I really did was I tracked submarines from the air.
The transition back to civilian life was tough. For decades, Bill struggled with anxiety, depression, and PTSD. He tried different medications, but nothing worked. Until he discovered a little-known therapy that he says transformed his life.
Basically, you put it like this, and they're going to strap it all on, and as simple as it gets.
It's a treatment for depression called Transcranial Magnetic Stimulation, or TMS.
It is non-invasive, non-pharmacological, no drugs.
Dr. Yashwant Chowdhury of CalTMS says it works by stimulating underactive neurons.
The activity of the brain waves is stimulated, and some areas of the brain where the blood flow has been sluggish, it can stimulate the blood flow.
The San Diego psychiatrist has 3 different TMS systems at his Chula Vista office: Brainsway, Apollo, and NeuroStar.
So you're going to bring you back?
They all use the same type of magnetic therapy to treat depression and anxiety.
There is no interventional stuff. It was simply placed on the scalp.
The magnetic coils sit over the prefrontal cortex area of the brain, stimulating the nerve cells that control mood and depression with magnetic pulses that sound like this.
It does 4 seconds worth of magnetic stimulation and then 11 seconds worth of rest.
Dr. Chowdhury says patients receive 3,000 magnetic pulses per session, which lasts about 20 minutes. On average, patients have 36 treatments. He says the side effects are minimal and the results can be dramatic.
It's a liberating feeling to get out of that misery every day.
Bill went 5 days a week for 60 total treatments.
What were the physical effects? What did you feel?
There's no side effects to this, really. You might feel a momentary loss or feeling, or your fingers might move, like kind of go like this.
Dr. Chowdhury has used TMS therapy on more than 1,500 patients, about 80% of them veterans. He says TMS is becoming more recognized. Bill's health insurance covered 100% of the costs.
It's life-changing. You can't imagine when someone has suffered for 30, 40, and some of these veterans even 50 years, and those are the people I'd love to see do this.
Bill finished treatment 2 months ago, but says he would do more sessions if needed. He says he is much happier, relaxed, and better able to deal with stress.
It doesn't rob you of any of your emotions. It allows you to have every human emotion that exists, except that it doesn't allow the emotions that seem to be harmful to you, so I feel like I'm normal now.
That's something he never thought he'd feel again.
I get emotional talking to my friends.
As this proud veteran prepares to retire from his second career at Collins Aerospace in Chula Vista, he still can't believe how different he feels today compared to his life just 6 months ago. These are tears of joy.
It's like you live in this dark, horrible world where you just think you're never going to get out, that your feelings are just stifled, you just can't, nobody understands you, and then all of a sudden, it's just like, it's a miracle. It just feels like you can function, you can be part of the human race again.
Thanks again for sharing your story, Bill. And this is interesting. One of the TMS companies, NeuroStar, just released its NeuroStar Depression Barometer, basically a survey of people with depression, which shows that nearly half aren't even treating their depression. And one of the main reasons is they don't want to take medication anymore. 48% say there aren't enough non-drug options, and only about 10% of them knew about TMS, and that's why Bill said he wanted to share his story. We've put a link to that full report in the online version of the story at cbs8.com. Also, It is FDA approved to treat depression and obsessive compulsive disorder, TMS. And there are trials taking place right now to see how well it works for patients with Parkinson's, Alzheimer's disease, and brain injuries. So, Carlo, that data is still being collected for review, but with much promise.
A lot of people are tired of using medications. They're looking for other treatments, so they're going to be interested to look into this. Bill mentioned very minimal side effects. Can you expand on those?
Yeah, I asked the doctor, too, to talk about potential side effects. And both Bill and the doctor say there aren't many for most people. Some headaches, maybe some irritation at the site on the scalp, but there are some things you have to be alert about. Like, you're not supposed to take any alcohol, drink any alcohol during the course of your treatment, because alcohol and TMS can cause seizures, so you have to stay away from alcohol. And there's some other, health history things that you have to talk about with your doctor if you decide to look into TMS and whether it's a good fit for you. But Bill says, for a lot of veterans especially, it is a non-invasive way to kind of treat something that's been, in his case, untreatable for decades.
It was nice to see a smile at the end there.
Right? He's so happy. He says he's high on life.
Thanks for helping us out, Bill.